Welcome everybody. Today I introduce you a paper about the ultrasound imaging of crural fascia and epimysial fascia in basketball players with recurrent ankle sprains versus healthy controls. We know that fascial layers may play an important role on locomotor mechanics, in particular in proprioception, and recent papers highlighted the role of the evaluation of thickness, fascial thickness in according and compared to joint flexibility in patients with different type of chronic pain, for example low back pain. For this, the purpose of this study was to assess by ultrasound imaging the thickness of crural fascia and epimysial fascia in basketball players with recurrent ankle sprains and versus healthy control. We created protocols and we evaluated the anterior compartment and in particular the level 2, the epimysial fascia, because here is possible to have the best visibility of these structures, but also in the lateral compartment, for example near close the peroneus longus and peroneus brevis, and the same for the posterior compartment. With 3 levels: posterior 1 near the gemellus medialis and gemellus lateralis for the posterior 2, and above the soleus for the posterior 3. The results were that we have an increase of the thickness in the basketball players, in particular in the epimysial fascia. Also, we have a decrease of the posterior 3 level thickness of the crural fascia. And in our correlation analysis was also evident that we have a negative correlations between the movement and the increase or the increase of the thickness. So maybe we have that one increases and the other decreases. And it was real evident in the plantar flexion, for example, of the ankle, but also there was a correlation with the Y-balance composite scores. So the take-home message of this paper is that it's possible to evaluate the crural fascia and also the epimysial fascia in basketball players with ankle sprains, and it is possible to have a role of the crural fascia in obviously in the myofascial force transmission, and this aspect is possible to translate in our thickness.